Welcome to Trial Site News Beyond the Roundup series. Today on our episode, we'll be discussing the recent outbreak of COVID-19 cases in India. We're going to talk about the cause and the solution that the country of India is engaged in. And so, from Trial Site News, I'm Adrian, and our episode starts now. So, the whole world has been watching India lately. Just a matter of months ago, India's cases and fatalities for COVID-19 were few, and now an explosion of cases throughout the country is happening. So, what happened here, and what is the solution for the outbreak? Now, since this story started unfolding, the mantra we have seen from many major media outlets has been that India lacked preparation, lack of following social distancing protocols, and lack of willingness to wear masks that have been at the top of the blame game for the spike in cases and fatalities. However, we here at Trial Site News have asked the question, is there more to the story than this? Well, Juan Chamey took a closer look at the data and found that it is possible to better understand the outbreak and to answer questions about the origin and spread of this recent wave and possible courses for successful treatment. So first, let's start with where did the outbreak start? Looking at case incidents per state, it is clear that India's second wave is mainly spreading from two distinct areas, the state of Maharashtra and the Punjab region, by way of Pakistan. Now, in the state of Maharashtra, case incidents per district shows strong indication that the virus has spread week by week from the districts of Nagpur and Amaravati to the rest of the state, including Mumbai. In the Punjab region, data shows that the outbreak originated in Lahore, Pakistan, and has spread into India by way of Delhi, India's capital territory. Now let's talk about how the virus has spread so quickly. And to do that, we're going to first take a look at the state of Maharashtra. The outbreak that started in the east of Maharashtra in early February moved slowly to neighboring states. However, once it arrived in Mumbai, cases exploded. The virus rapidly spread to other states. And at the end of March, only Maharashtra had an incidence over 150 cases per 100,000 individuals. But by April 10th, more than 10 other states crossed this threshold. So what happened here? Well, Mumbai plays a huge role here. Mumbai has the highest percentage of migrant workers in India. Nearly 50% of the whole population lives in Mumbai temporarily or seasonally for work. When cases there surged, people fled, fearing an imminent lockdown and losing their jobs. When they fled the COVID hotspot, they traveled in packed trains and buses, bringing the virus with them to their hometowns. An example of this would be the capital city of Uttar Pradesh. This city is the principal source of migrant workers traveling to Mumbai for temporary or seasonal work. Cases in the city and surrounding area exploded suddenly in the last week of March. No other city in close vicinity had an outbreak before this time. But the virus didn't develop locally. It is more likely that the new outbreak started when the hundreds of thousands of migrant workers fled from Mumbai back home, bringing the new variant of the virus with them. Now let's take a look at the Punjab region. The initial spread here, from Lahore to Punjab and into Delhi, was by the book. In other words, a traditional town-to-town spread. What is now most concerning is Delhi. The city is experiencing the worst outbreak in the country, with death per population 50% higher than its nearest neighboring city. With the announcement of a lockdown, migrant workers began fleeing the city in the last week of April, most likely carrying the virus with them to their hometowns. So now let's shift gears to the treatment and media influence in India. Now, since the outbreak of COVID, 3 treatments have been battling for attention all over India. Last year, until mid-June 2020, the clear favorite was hydroxychloroquine. This was then replaced by remdesivir from mid-June until early August of 2020, and from the end of August, the new favorite in India became ivermectin, which remained at the top of the list until the end of March. So, where does it stand now? Well, on April 22nd, the Ministry of Health, AIMS, and ICMR updated the National COVID-19 Treatment Protocol. This new protocol includes recommending ivermectin and budesonide for all patients with a mild case of COVID-19. On April 28th, a new, more detailed document was released in which the Ministry of Health advised patients who are asymptomatic or have mild symptoms to use ivermectin and budesonide, and not to use remdesivir outside hospital facilities. And then on April 29th, in a press conference, the Ministry of Health once again confirmed the new protocol. Now, however, despite the government's persistence in promoting ivermectin and budesonide, the media hasn't shown interest in sharing this news. The comments continue to promote remdesivir as an effective drug, and the few media outlets that even bother mentioning ivermectin refer to it as the unproven medicine or an outdated treatment. It's as if there are two different realities, on the ground and in the local health systems. Millions of patients are now receiving ivermectin, yet one would never know by the media topics. It's almost as if there is a blackout on the topic. Now, when it does surface, it is mentioned as outdated or inappropriate. Now, to this end, I'm also going to take a moment to note that here in the United States, as of the filming of this episode, the official US guidelines from the Food and Drug Administration and the NIH are as follows. First, the FDA has cautioned against the use of ivermectin for use against COVID-19, saying that they have not approved ivermectin for use in treating or preventing COVID-19 in humans. The FDA has also added a notice about the use of the animal version of ivermectin, saying that one should never use medications intended for animals on yourself. Ivermectin preparations for animals are very different than those approved for humans. Secondly, the NIH has a softer stance on the subject of ivermectin, with a more neutral stance. They are neither for nor against the use of the drug. They say that there is insufficient data to recommend either for or against the use of ivermectin for the treatment of COVID-19. Results from adequately powered, well-designed, and well-conducted clinical trials are needed to provide more specific, evidence-based guidance on the role of ivermectin in the treatment of COVID-19. Now, let's go back to India. At the national level, the massive surge that overtook the country at the beginning of April slowed exponentially after the new COVID-19 protocol was introduced, which, as I alluded to earlier, includes the use of ivermectin and budesonide. COVID-related deaths plateaued on April 28th, and cases seem to have followed the same pattern where the regimen is at work. Cases in Uttar Pradesh, hometown to many migrant workers who fled Mumbai, have been dropping since April 24th, and deaths have dropped since April 30th. So to wrap this all up, data reveals that the new outbreak and rapid spread of COVID-19 in India hasn't necessarily been caused by general pandemic mismanagement. Rather, the data reveals that the suspected culprit here is E484K, which of course is the new mutant strain. Furthermore, analysis of the data indicates that the traditional spread from area to area was accelerated by migrant workers fleeing hotspots in an effort to avoid city lockdowns. And to reiterate, while the implementation of ivermectin and budesonide as a protocol appear to represent a population-wide early care regimen, the media there is hesitant to report on this topic. Now, all of this analysis by one covers high-level population data, and an important subsequent topic of study would be to compare the transmission rates, disease progression rates, and death rates among population exposed to the current ivermectin and budesonide regimen versus remdesivir and other courses of action for more granular insight into care strategies. And of course, as always, we'll be keeping an eye on this situation and keeping you posted as new updates continue to come in. And that, my friends, brings our episode to a close once more. As always, thank you so much for joining us on this program today. From Trial Site News, I'm Adrian, and I will see you all next time.